Hi guys, I'm Adriana, the SPTA. Thank you all for joining me here today. As you read in the title, we're going to be going over the arm sling. So what is this arm sling used for? It's mainly for those patients that go through shoulder surgery mainly. So some precautions that we want to keep in mind with the arm sling is that we're not really using our shoulder actively, so no active range of motion is something that we kind of want to avoid with these arm slings when we're taking it on and off. So like I said, today we're kind of going to be administering how to put this on, how to take it off, some red flags we need to be aware of, or if you ever see anything like that. Also some skin inspection stuff, and then making sure that we're taking care of the equipment properly. So now that we've gone over those basic things, I want to talk about how to take it on and off. So most patients that come out of surgery already have this on, so it's a lot easier to teach you guys how to take it on and off when it's already on you. So we're going to go through some basic things. So what we want to do is the first thing we want to make sure is that all the clips are already clipped together to your size. We don't want to mess with them really. It's just a lot easier that way. So the first thing I'm going to show you guys is we want to make sure that we take this belt off first. So the body belt, right, the strap, we want to make sure that that's off, right? Alrighty, so now we want to make think of it like a messenger bag or a sling bag, something that, or a crossbody bag or something like that. So now what we're going to do is we're just going to take it up and over, avoiding that active range of motion in the shoulder, and it should just easily slide off, right? So simple as that. Same thing goes for when you're putting it on. So when we're putting it on, we're going to mainly use our left hand or the hand that is not involved to do most of the work for us, just because we don't have that active range of motion in the shoulder. But we're going to slide our arm through, making sure everything's lined up properly. Remember that messenger bag, putting the sling over our heads, avoiding active range of motion in the shoulder. It might be a little wonky when you first put it on. That just takes practice to get used to. So we're going to make sure that everything's aligned. And so making sure everything's comfortable, strap is comfortable, and then you want to grab that sling again that goes around your body, so the body sling, and then we're just going to clip it in as normal. So easy peasy lemon squeezy, right? Like I said, it might just take a few practices. We do want to make sure that our arm is at 90 degrees, that our elbow is touching the back, and obviously we're avoiding the active range of motion in the shoulder. So when we wear this for long periods of time, we want to make sure that we're checking our skin to avoid those wounds. I go into a little bit more of a deeper video on skin, making sure that we are aware of skin and that no wounds are developing. So if you want to click on that video, very helpful and very good information on that video. Also, when it comes to our devices or anything in general, we want to make sure that we're taking care of the equipment. So most of these slings have Velcro. We want to make sure that the Velcro isn't just wearing off or something's happening to it. Feel free to ask us, the PTAs. Also, your doctors can be a huge help in maintaining the good health of your equipment, right? So don't be afraid to ask for either something new or some more information on your arm sling. Also, when it comes to this arm sling, like I said, a lot of patients wear it for long periods of time. So there are some red flags that might occur when it comes to the arm sling. So some things to be aware of are just increase in pain. If you have increase in pain while you're wearing this, please do not hesitate to call the doctor, consult your PT, PTA. Those are things that we want to avoid. Also, like I said before, some wound development. If you think when you're doing your skin assessment and your skin isn't blanching, right? We want to make sure that we're telling our doctor and our PT that that is occurring, because that could be a development of wound. Also some loss of sensation, and just in general, Any abnormalities, any abnormalities is a big indication on calling your doctor. But those are just the basics. So thank you guys for joining me today on how to don and doff our arm sling and taking care of our arm sling. And have a great day.